Good afternoon. And today we have an honor of interviewing Dr. Funke Afolabi-Brown. Good afternoon, doctor.
Thank you so much for having me, Dr. Maria.
And we're all yellow in the honor of just, what the International Women's Day just passed. And I'm so honored to interview Dr. Brown, who's such a prominent, successful professional. And she kind of represents the womanhood. She's a scientist and she's a mom, and she's trying to help all children to sleep better. Um, First of all, thank you to our audience. And if you have trouble sleeping or sleep next to the snoring partner, or you're concerned about your child's sleep, this program is for you. If you're a medical professional and just like us, you're looking for the answers or put together puzzle of this dangerous disease, what affect our humanity, like an evolutionary standpoint, this program is for you. Only together as a community, we can put all these pieces together and find the better treatment for our patients. And again, my goal to create a community or to create a bridge between medicine and dentistry. And today is such a great representation of that because Dr. Brown, she is looking to make our future population healthy with a good sleep. Now, my personal story, I heard about Dr. Brown from a lot of sources. Of course, she's a very popular, very influential on Instagram, and I listen to a lot of her interviews on Instagram, and I highly recommend you to visit her channel. And then I heard about Dr. Brown from the other source, from somebody I highly respect, editor of Sleep Tech magazine and founder of Philadelphia Sleep Conference, gentleman named Mr. Michael D. Domenico. And now I'm all looking forward to listen and meet Dr. Brown in person on the Philadelphia Sleep Conference, which is going to be March 22nd. And underneath this interview, you will find a special promotion or code what you can use to get the discount to attend the conference. And now I would like to fully introduce you, Dr. Funke Afolabi-Brown. She is the first medical doctor on our channel who treats pediatric sleep apnea. We have a lot of dentists who are passionate about that, and we have a lot of medical doctors who treat sleep apnea for adults. But you are the first pediatric sleep apnea specialist. And she is triple board certified physician in pediatric, sleep, and just remind me the third one.
Pediatric pulmonology.
Pediatric pulmonology, yes, I just don't want to say it wrong. And as well as she's the mom who struggled with the sleep issues for her kids, and like a first line. And also she's nationally and internationally recognized speaker. She speaks on a lot of conferences, including Philadelphia Sleep. I'm looking forward to listening to your presentation. And she's very passionate about topic of pediatric sleep apnea and collaborating with other professionals. I saw a lot of very interesting interview on your channel, as well as with the dental community. We're very happy about that. My first question to you, Dr. Brown, please tell me what are uncommon signs of pediatric sleep apnea in children?
Yeah, that's a great question. So in children, I think some uncommon symptoms that you might find are things like teeth grinding. Many people have teeth grinding, but it could be a sign of sleep apnea in children. So that's one. Another one I would say is bedwetting, something we call enuresis, which is, wetting the bed. And usually it's called secondary enuresis, meaning that they've been maybe dry before for a period of time, and then all of a sudden your child starts bedwetting. That may be a sign of sleep apnea. And then I think another one that's relatively uncommon is the daytime hyperactivity. And that may be a sign that your child's sleep is disrupted. And there are many reasons why a child's sleep is disrupted, right? They may be having sleep apnea. They may just be having a lot of wake ups because of restless sleep. But that can be a sign of sleep apnea. Usually, you get one of these symptoms in addition to some kind of either snoring or difficulty breathing during sleep.
I would like to ask you, what would be, I'm very much aware of treatment of sleep apnea for adults. I provide a lot of them in my practice, but please educate my audience about possible treatment of pediatric sleep apnea.
Yeah, there are various alternatives to treatment of pediatric sleep apnea. The first line therapy that we've known for a while is removal of the tonsils and adenoids, and that's known as adenotonsillectomy, because that is one of the most common reasons why children have snoring and sleep apnea. The second type of form of treatment can include, so that's kind of surgery. And then there are other types of surgery, including, sometimes some, tongue tie, sometimes some airway jaw reconstruction. So that's the surgical category. The second one I would say is the sort of medical category. So that includes things like CPAP, continuous positive airway pressure, where you're using the face mask with a compressor to pump air to the back of the throat. Usually for children, that takes some getting used to, right? But we can definitely get it and it's effective. And then in that category, sort of the more kind of medical category, we'll say, things like medication management. If, for instance, if you have a child who has comorbid allergies, you may put them on allergy medicine. I mean, usually that's for the more mild sleep apnea, right? If you have moderate or severe sleep apnea, then you want to do surgery or CPAP or things like that. And then again, under the medical, I think I would put something like, weight loss. So that's a lifestyle intervention. Now we know that weight loss is contributing significantly to sleep apnea, is a contributor to sleep apnea in children. I mean, depending on what studies what you look at, it could range anywhere from 13% of obese children have sleep apnea to as high as like almost 50%. So it's so wide because the studies are not very um, well conducted, and there's so many other factors that are playing a role. So that's the medical. And then the final category I would say is kind of like more of the oral, dental appliances and strategies. So, oral appliances are really effective. We now have studies that show that in children in reducing the severity of sleep apnea. Orthodontic interventions, whether it's palate expanders and things like that as well. And then, we have things like myofunctional therapy, which is really about strengthening the airway muscle tone, and that can be used in children also. So I think this is really helpful and it's really exciting because parents don't necessarily only have surgery or only have CPAP. And so there's a wide variety of options available now for treating sleep apnea.
It's so nice for me to hear what you consider dental options on the landscape of treatment of sleep apnea. I personally very passionate about that line of defense, and I do see it's working really well. And a lot of things change. People start, little kids start growing once we establish proper airway. So a lot of wonderful things. But the question what puzzle dental community, not dental dentists, but dentists, my functional therapists, physical therapists, people who are in the realm of myofunctional therapy or orthodontic treatment, orthodontists, pediatric dentists, how to find the bridge between dental and medical community, how to put us on a map. What would be your recommendations, Doctor?
Mm-hmm. I think a great example is what we're doing right now. I think it's to have conversations because if you think about it, it really is interesting that where just really starting to pick up on these conversations. I mean, you're the dentist, you're in the airway. We know the role of the tongue in breathing. We know the role of the face and the facial structure and the jaw in breathing. It's also related. And I think it's really about, again, collaboration by having those conversations and putting work like this out there for people to see, to create that awareness, because especially for those my medical colleagues, we've just been so used to the path of CPAP or surgery, but really now now there's emerging data, there's studies that are showing the efficacy that, oral appliances and working dental interventions are effective. There's the American Dental Association for Sleep Medicine, so there's so many organizations that are picking up. So I really just see that it is inevitable. In a matter of time, we'll definitely be talking more and be collaborating more. But I think really it is about having conversations.
I really hope so. And I noticed on Philadelphia Sleep Congress is going to be, 8 hours, but only one dental lecture. So I hope maybe next year it's going to be more with our effort. But I really appreciate what you giving us hope. What medical community going to take us seriously, not as a tooth mechanic, just as a scientist like they are. I really, that's my wish, like New Year wish. I don't know, every holiday wish is that, but we're going to be perceived seriously because we really have a patient best interest in heart. But it's hard sometimes to get the word out, or to open the medical office door, maybe I would put it to say, or to open the ears of medical professionals, but we not, money hungry tooth mechanics, something like that, like how they portray us in the media. We are actually scientists with a message. But, I'm sure time change and maybe we can do something. But I'm going to ask you another question. What a lot of parents concerned about that situation with the night terrors. What can you, what exactly would be the, maybe reason and how to approach a lot of patients, a lot of parents of the patients get very scared with such an experience. What can you say about the night terrors?
Well, yeah, I think the first thing to know is the child looks, when a child is having a night terror, we now call them sleep terrors because they don't only occur at night, is that the child looks extremely terrified, maybe wakes up, sits up in, not wakes up, but sits up in bed, looks straight ahead as if they're seeing something, they are terrified. They might have this increased autonomic response. So they may be sweaty, they may be, their heart is racing, they may be screaming, and they're often inconsolable by the parents. And, the parents are making an effort to comfort them, and they just don't seem to be there. And so what that really shows is the child is not even aware of what is going on. And so while it looks like your child is suffering, they are not aware. And usually in the morning, and that's really what is very classic of sleep terrors, is that in the morning, they're just like happy-go-lucky. You're the parent, you're stressed out, and they didn't even have any idea, compared to nightmares where they had a bad dream and they usually will wake up and tell you what happened. So first, realizing that your child is safe, they look distressed, but they're not suffering. They're not even aware of what is going on. And then the second thing really is safety, because sometimes kids can injure themselves because they're so agitated. And then the third thing I would recommend is, in terms of how do we manage it, is one is, you don't want to try to wake your child out of a sleep terror, because what happens is you might actually extend the terror. It may make it worse. So you may want to just comfort them, be there for them, make sure they're safe, and things like that, reassure them. And then one of the things we found out that might contribute to sleep terrors is insufficient sleep and stress. So managing that really with sleep extension, stress management, and things like that is very, very helpful. Now, if you have a child who is having repeated sleep terrors and it's almost like clockwork, then sometimes what we do is we call it preemptive wakening. So say about 15 minutes or 10 minutes before the time, like you're like at 11 p.m. on the dot, this child wakes up and is screaming for 10 minutes or whatever, you can come into the room and just gently wake them up before they're likely to have that terror. And so what we've seen is that it almost like bypasses that episode. So you wake them up, maybe give them a sip of water or let them use the bathroom and return to bed. And many times that just helps avoid the episode. Now, if you've done all of that, you've extended sleep, maybe you're doing preemptive wakening and they're still having these issues, then sometimes we talk about, okay, what else could be waking them out of sleep? What else could be causing that? And that's when you really should check in and say, maybe they have a sleep disorder. Maybe they have sleep apnea. Maybe they have, restless leg syndrome or periodic limb movements of sleep, which is what we call that. And so really treating what is underlying, usually will take care of the sleep terror.
Oh, this is great. This is a lot of practical recommendations for parents to work. And now I'm going to ask you the question what's so close to my heart. Very often, I get a family was suffering with obesity. I'm very passionate about that issue. I brought some people who specialize in nutrition, authors of the book. I know it's a evolutionary problem as well, but uh, very often these families feel totally helpless because they go to the medical doctor, to pediatric medical doctor, and they don't find the answers. So, since we know, and you mentioned in your previous answers, what obesity and apnea goes hand in hand, not correlate 100%, but quite close in, in the problem. What uh, treatment strategy at the present time exists for patient and what parents can do to start the treatment for the child who is obese, and might suffer from sleep and breathing disorder as a result of the obesity. What can be done?
Yeah, so there are different things. I mean, most times we start off with lifestyle management. So many times it's around optimizing their diet and optimizing fitness. So when we're thinking about that, we're thinking of, what are they eating? So a lot of kids, unfortunately, are eating a lot of processed foods, a lot of sugary juices are a heavy source. They're a large source of sugars, which can contribute. So cutting back on that is one. Like we talk about low hanging fruit. So that is so important. That's somewhere we can start from. And we can make it like a whole family mission. Let the entire family cut back on the juices and get more fresh foods, fresh vegetables, which is healthy and more wholesome and helpful. And then the other piece I would say is, physical activity. So making sure that kids are outdoors, usually I would say for at least an hour every day, as much as possible. If you're in a community where it doesn't feel safe to be outside or parents are working, then thinking about ways to be creative even within the home, whether it's going up and down the steps, whether it's playing, a lot of kids are on their devices nowadays. So maybe we switch it to a game that involves a lot of movement, right? So a YouTube video, something of that, so that gets kids moving. And then the third thing I would say too, along the lifestyle, is sleep. So if they have sleep apnea, it's of course, it might be because they are overweight, but because they are having fragmented sleep, they are at risk for obesity. So it's a vicious cycle. So you want to make sure, I mean, the goal is that when we lose weight, hopefully the severity of your sleep apnea improves, but that's going to take a while because obesity did not show up overnight. So what you want to do is make sure you're treating the underlying sleep issue. So if they need CPAP, if they need surgery, if they need whatever they need, you're treating that on that weight loss journey, because improving the quality of sleep actually will help them burn those calories better, and help them with metabolism, right? And then, of course, you want to make sure that and then there's some other treatment options. So bariatric surgery now, especially in our older teenagers, is approved for, especially if they're extreme obese. You have to meet certain criteria to be able to do that. Maybe have other comorbidities and things like that. And then also some medications. So for instance, things like, Ozempic and all those are actually approved in certain types of obesity in children. Again, certain criteria needs to be met. So I'm saying criteria, criteria, criteria. By the time you start to get to that level, it's important that you're followed by usually an obesity medicine specialist or at least an endocrinologist, because there are other causes of obesity that might be central in origin. You might have thyroid disease, you might have different things, Prader-Willi genetic syndromes that might be contributing to obesity. So you want to make sure that you rule that out, and then they will be able to say whether you would qualify for some of this more, I would say, more aggressive methods of management of obesity.
Thank you very much, doctor. It was such a, light on that problem. Thank you very much. We appreciate your time, and I highly recommend to our audience check your website, check of course your Instagram channel, and for medical professionals who want to, listen, to be in the presence of Dr. Brown, I highly recommend to attend Philadelphia Sleep Conference on March 22nd, and you can find the code underneath this interview. Thank you very much, doctor.
Thank you so much for having me.